So now talking about the pathogenesis of the stroke. We'll talk about the ischemic stroke. In ischemic stroke, we have already learned about the causes, the risk factors, and we know that it is basically atherosclerosis or thrombosis, emboli, which leads to ischemia. Okay, so there's this acute arterial occlusion of intracranial vessels, right? The starting was because of this arterial occlusion of intracranial vessel. What will this arterial occlusion lead to? It will lead to decreased blood flow to the brain, right? Now, if suppose there's this decreased blood flow, okay, but within a few time, within like before the significant infarction develops, so before the hypoxic injury happens, the blood flow is restored. Okay, body restored the blood flow. Okay, if this happens before the if the blood flow is restored before a significant infarction develops, then that will lead to transient ischemic attack. Okay, but now we'll see the other part, that is for the stroke. That this was about transient ischemic attack. So here there's this decreased blood flow to the brain. Okay, decreased blood flow which lead to what? Obviously ischemia, barabar. So it will lead to ischemia, and then there's this arterial occlusion. Okay, arterial occlusion hua, there's this thrombus in the arteries, the body will try to thrombolyze it. Okay, so thrombolysis होगा, and there's this and arterial occlusion की वजह से inflammatory response भी आएगा. ठीक है, so decreased blood flow to the brain की वजह से पहला तो there's this ischemia की वजह से energy failure like ATP नहीं produce हो रहा बराबर, that is energy failure. Okay, which will lead to calcium and Na plus influx. This leads to the damage. So calcium and Na plus influx will lead to cellular damage. Now how does this lead to cellular damage? So calcium and Na plus influx will lead to mitochondrial damage. Once the mitochondria is the powerhouse, right? So once the mitochondria is damaged, it will lead to apoptosis. Okay, then this calcium and Na plus influx leads to proteolysis. Proteolysis की वजह से there's this membranous cytoskeleton breakdown, because everything is protein in a cell, right? Most of the things. So this will lead to cell death, and because of this calcium and Na plus influx, there's this INOS, because means inhibitory nitrate. Okay, which leads to free radical formation. Again, free radical formation leads to cell injury and cell death, right? So this was about ischemia leading to energy failure, which further leads to calcium and Na plus influx, which will lead to mitochondrial damage, proteolysis, and release of INOS, nitrate oxide synthase, which leads to free radical formation and eventually leads to cell death. So this was the one part. And we also know that there's this arterial occlusion. Because of arterial occlusion, there will be thrombolysis, and arterial occlusion itself will also lead to an inflammatory response. Barabar? So because of all these things, there's this leukocyte, because of this inflammatory response, there's this leukocyte adhesion, arachidonic acid production, which further leads to formation of free radical. Once the free radical is formed, it will lead to membrane and cytoskeletal damage and cell death. So basically, if we talk about the gist of pathogenesis and ischemic stroke, is there's this arterial occlusion. But because of arterial occlusion, there would be ischemia, right? If there would be ischemia, there would be energy failure, because ATP form नहीं होगा. ATP नहीं form होगा तो calcium and Na plus का influx होगा, and this influx will lead to mitochondrial damage, proteolysis, and free radical formation. All this free radical formation and everything will lead to what? Cell death. So impaired functioning, neuronal death, along with the and also arterial occlusion will lead to inflammatory response, which further leads to increased arachidonic acid protection, which will lead to again free radical damage, and then again the cell death. So this is all about the pathogenesis of stroke. So basically, because of ischemia, there is cell death. This is what the gist is. And how does this happen? Mostly because of free radical formation, proteolysis, mitochondrial damage, etc. Okay, so this is how the pathogenesis of stroke is. So we understood the definition of stroke, we understood the causes and risk factors associated with stroke, and we also understood about the pathogenesis of the stroke. And now we'll be talking about the clinical features of the stroke. Okay, got it. This is how stroke happens, but how does the stroke present to us? So now the manifestation of stroke will depend upon, like there's this thing known as stroke syndrome. The manifestation depends upon the area which is involved. Okay, so suppose there's this large vessel stroke. we learned, right, thrombosis leads to large vessel stroke. So if there's this large vessel stroke which which covers the anterior circulation, right? So there are different manifestation. Okay, then this large vessel stroke covering the posterior circulation leads to different manifestation, and then small vessel stroke, that is lacunar stroke, will lead to different. Okay, so we'll be discussing the clinical features as large vessel stroke with anterior circulation, large vessel stroke with posterior circulation, and lacunar stroke. These are small vessels. Okay. The large vessel stroke with anterior circulation.